Dr. Scott Miscovich joining us on site from the Cocoa Head drive-through testing that you're holding today. Just give us a quick overview about how the testing's going. And then also last week in Maui and over the weekend, a lot of sites in Oahu.
Yes, testing is interesting. There's a trend that we're seeing, which makes sense for where we are right now in this whole COVID pandemic. The volume at the drive-throughs is significantly slowing down. And like I was mentioning to you earlier, we're here now and we've been open for, 20 minutes, 30 minutes, and we probably have had about 30 cars come through. We'll get this initial burst and then they'll just kind of trickle through. If we go back yesterday, we were at Kaka'ako, and what a difference a month makes. A month ago, our first Kaka'ako, we had 700 cars at least they counted in line. Yesterday, we had a total of screens were 85. Kahuku, since they have been uncovered, there was a few more up there. We were in the mid 150s or so. And bottom line is we're seeing across the island that the numbers are going down. Of course, we had that big surge a week ago Wednesday when we went to Kahului for the outbreak that occurred in Maui Memorial, and that was second only to Kaka'ako with how crazy we screened 700 and some individuals. And the bottom line is that that Maui has since dropped down also. So there is a trend across the island that people are listening, and there's a reason this is happening. So we're pretty pleased where we are right now, but we're just starting. As you're reading everywhere, testing is the key, and we're just starting.
Well, it's good news indeed. And I just wanted to ask you briefly, you were also on the Big Island, and we're seeing that Kona outbreak start to grow.
Yes.
Any insight or your take on that?
That's a perfect example what the state and the people of Hawaii need to be prepared for. Clusters. We're getting down where, without tourism of any significance that's coming that can spread it. And again, I also want to highlight something I've reiterated to the people of Hawaii. Just because tourism is down, your returning family members or loved ones that are coming from schools or work, they still have the potential to spread. So do be careful and quarantine everybody when they come in, even though we want to hug them all and sit around the kitchen table. You got to be careful and be aggressive if anybody gets symptoms. But the bottom line is that the cluster over in Kona, is all coming from the individual that worked there, and then it went into the families. Hawaii, that's what life is going to be like over the next 6 months. That's what we're going to face as we're into phase 2 of this crisis, where we're going to get clusters, and then they're going to need aggressive tracking, and depending on how large they are, the amount of people we're going to have to screen will vary on the size of the cluster. So the Maui is the best example. Kona is there and growing, and there's a small cluster on the Hilo side. So our team right now is preparing, and I'll probably be with them because we're splitting into so many locations. We're going to the deep reaches of the Big Island. We're sending a team to Ka'u, Honoka'a, North Kohala, and we're still keeping up with Hilo. And fortunately, we started the Kona screening, and when we were there, we had great partnership from the Ali'i Health and the West Hawaii Community Health Center. And so they have perpetuated the screening without us having to fly a team over. And they're doing 3 days a week. They have 2 days that they're doing, I think, at the shopping center in Kona during the week. And then they're going up to Ocean View one day to start to try to reach up a little bit to the higher edges of the people over in the Kona coast. So it's happening, the screening, without all those screening sites, we would have never found these, for the naysayers of screening. That's how we found the screening positives with the work of Ali'i Health and West Hawaii Community, who's out there testing people.
Yeah, nonstop for you, Scott. Again, the issue for some people is they're so confused. Can they go if they don't have symptoms?
We're still not screening pure, broad, asymptomatic. There are categories where you're asymptomatic and we are screening, and that would be if you're living in a household of an individual who has had COVID, or if you've had close contact with an individual. Perfect example is the positives coming out of Maui Memorial are all the coworkers within the same units that were working with the positives. And they're not family members, but just because they've been in an environment and maybe spent 3 hours, 4 hours, 6 hours, 8 hours, they're popping positive all the time. And I got to mention this because, as you face this is so much not discussed by our leadership here, but us in the field who are really pulsing this. My last 10, it's 10 as of the 2 I got called about yesterday on Maui, all are asymptomatic positives coming out of Maui Memorial. So think about that. These people are positive, they could be spreading it, and unless we aggressively screen them because of their environment, we would have never found them. And who knows how that cluster could have expanded. So we have to continue to use the best data that's available across the world, which shows that 20 to 40% or more of everyone with COVID may be asymptomatic and still be spreading. So that's key for the people of Hawaii. Now, again, we're not at the point where every individual is going to get screened. We're moving that way as testing kicks up. We have a lot better testing now in the state, yet at the same time, it's not, not being talked about how expansive our test is back. Let me give you an update, Annalisa. I did the screenings, with our teams for Kahuku on Saturday. All of the test results are already back for Kahuku.
Wow.
Yep. Yesterday's, I'm expecting today. We now have 800 tests on island that are being done same day. Now do the math. 800, 5,600 in a week. We've only done 20,000 over the last, 5 weeks. So we basically have almost now hit the capacity where if we even use the same volume of testing, which is even going down, that we can do all our tests on island with almost immediate same day results. But once again, no one's standing on the mountain shouting that, how important that is to the people of Hawaii, which is very, very important. And it's going to enable rapid identification of positives with rapid isolation, quarantining, tracking. And we're just starting.
Wow, that's amazing. So again, there was a lot of questions coming into from our viewers about whether their tests are in. So are you saying that as of now, all of the tests that we've done, have those, at least that your group has done, have come in? Those results are in?
Okay, now understand the timeline. The diagnostics lab, as of Thursday night, kicked up to 550 tests per day on island, and clinical labs has kicked up to 2,500 or 250. That was just as of Thursday. If you were tested prior to Thursday, it may be that some of your tests were sent off to the mainland, and that would put it back in the queue. So what we're talking about is now contemporaneously moving forward. Most all the tests that we're doing, unless we exceed that 800 per day volume, which, as the volume's going down, I just don't see it happening, are all going to be done almost in 24, no more than 48 hours. But most of them are coming back the next day, which is excellent news for the state.
Yeah, good news indeed. Okay, I wanted to segue to another issue that we talked about briefly before, is the homeless population.
I lost you.
Are you still there?
Yeah, now I got you back.
Okay.
Okay.
There's a concern that, like you mentioned, this is spreading within, asymptomatic people, especially in homeless populations and shelters and group living situations. What are you seeing in terms of your work? You're working on the neighboring islands.
Yes, a couple things that, again, keep me up at night, and I have said this in public before. I think our last untouched major issue that we have to worry about are our shelters, where if we get this running through our large group shelters on Oahu, we could shut Queens down in 2 weeks. And there's nothing being done to address those shelters the way that best practice and CDC has asked us to do it. And again, I want to highlight this to tell you again what this probably is the single thing that keeps me up the most at night. A former colleague of mine when I was at Harvard in the 1980s, Dr. Jim O'Donnell, who we all refer to as the father of homeless healthcare. He started homeless healthcare, healthcare for the homeless of Boston, and he's published everything. And he's one of the docs that I use to help design the H4 program with. He just screened his one shelter there with 490 residents and found 140 asymptomatic positives in one shelter. And that was published across the United States. And you couple that with the fact that New York just had 24 people die in a shelter. San Fran just had 95 positives out of one of their shelters. King County had almost 20 some positives. it doesn't take a medical professional to understand these shelter environments, which have people stacked on mats 3 feet away from each other, or bunk beds that are lined up 20 deep just next to each other, is just a perfect breeding ground for COVID to spread. So what happened is, remember, our group were private groups with tons of amazing volunteers. And again, I can't say enough about the amazing volunteers from every island stepping up. It's incredible, these heroes. And I just want them all to be able to just stand up and be to be given the credit. But like, for example, Mayor Kim's team on the Big Island, we are working very cooperatively with them. We're being invited into the shelters. We're screening the shelters. We're taking teams in conjunction with their EMS, with their city workers, county workers. Same thing, I just got called twice by Mayor Victorino. Just within the past 20 minutes, I'm communicating with the shelters on Maui, since they do have a positive, almost 2 positives in the shelter over there. And we are invited back this week to go screen shelters on Maui. And so we're very happy that the neighbor islands are opening up the doors, knowing what the risk. We also have been asked, again, by the lead people in Molokai and the mayor's team. There's a beach encampment of about 60 homeless living in the beach in Molokai, and we're getting flown back over there to take a team into that beach encampment, which we want to address. So it seems like everything is working, but the biggest risk is Oahu, which has nothing going on right now to address this population.
Yeah, I wanted to ask you, I actually covered the Iwilei facility that opened on April 1st. We were at the press conference with the mayor and everyone, touting this as the first of its kind on-site testing, screening facility where, I thought we would see lines of our unsheltered residents go and get testing on site, but we're not seeing that. And now we're seeing, at least I heard from people on site, that they're not actually doing the testing on site. So what happened there? I mean, there was no announcement on the change in strategy there.
Well, basically, the mayor, I think, was very, very well intended. His heart was in the right place, but and as you probably well know, I was with him side by side for all the announcements, because I actually worked with city council and the mayor's team individually, and I'm not blowing my own horn. It was basically me that they turned to and say, help us design this. And we did it, we designed it, but at the very last minute, the mayor said, listen, we have the owner of the building, but we are not a healthcare facility. We got to sign a lease over to someone. So literally right around the time of that press conference, he signed a lease with Department of Health to run it. And I think that's when things kind of turned in a whole different direction from what the original premise was of the building. And so from that point on, it was turned over to the Department of Health somehow appointed social worker Ed Mercereau from ADAD. And he, clearly understands the drug addiction and alcohol addiction part of it. And essentially, it's now been turned into primarily a drug and alcohol shelter for people with, I think there's 24 residents that have been seen there. And I don't know if any screening that's been done. I guess screening's being done somewhere else, but it didn't turn into what we expected, which was similar to what we're doing on the neighbor islands, where we had envisioned what my plan was with this, as the person who helped found it with the mayor's team, was that we would take external medical experts that would then go into each shelter. We would then identify high-risk individuals, those that if they got it where they had high blood pressure, diabetes, heart disease or something, and then we would look for them for symptoms, and we would aggressively screen them first, because those people, if they get COVID, they could be on a ventilator in 10 days. And you get 20 of them, there goes one intensive care unit. So you would aggressively screen that high-level group that is very at risk, and then you would just keep coming down. And we thought that we would be turning 24 people a day over in that shelter. And then those who tested positive, you would keep them there. And they were being, Local 5 has been a great partner, and Eric and his team are there standing up. And then all of a sudden it just turned into where, no, this is more focused on addiction and drug and alcohol. And it's all the people involved don't have any COVID experience. They're all drug and alcohol people. So I don't have any answer. That's where it stands. And unfortunately, there's really no address of of COVID in the shelters at this point.
And like I said, at least you're doing it on the neighboring islands, but we'll have to probably wait to see what the state actually is planning for our island, because there's lots of huge populations here in different pockets.
Yeah, I mean, we all know what kind of crises we have with homelessness right now. And the other thing that I proposed, this was 5 weeks ago or 6 weeks ago, if you look at CDC guidelines, and again, this is common sense. You don't need to be a doctor or a public health person or an epidemiologist to be understanding this. You take a shelter and you have people stacked on top of each other using CDC guidelines and best practice guidelines across the country, which many other cities have already implemented. You basically need to thin our shelters on Oahu by probably 70 to 80% of every resident. And they need to be taken out of that shelter and put into some kind of environment to basically separate them enough so that they're not going to spread it if somebody gets it. And I actually made all the proposals. I did the design. I actually went as far as 2 landowners that own the vacant Kmarts. We have one out in Kapolei and we have one at Stadium Mall. We're willing to work to make those available, to turn those into large open group areas. And I got no support from anyone to even listen to that. And here we are 5 weeks later. And the other option I had said was, look at what happens across the United States. When you have crises, you have hurricanes, you have things like this, where do people go? They go to their big stadiums. So the other proposal I made, and I made this back March 22nd, so we're talking quite a long time ago, was take Aloha Stadium and basically, you know, the grand concourse that goes the whole ways around Aloha Stadium, get the cots and tents that are available, which are available through Haima, and basically you could fit, if you do the measurements, you could fit almost 1,000 of them around there and still give people about 20 feet in between. And what do you have? You have bathrooms, you have food service, you have open air, so there's breezes. And then what you do is on the Jumbotron every night, put a movie on, put everybody to go social distance out there. And then you put the medical people on site and you basically provide medical services for whether it's their addiction or mental illness or whatever, but at least you have all those people in one area and they're not in an enclosed shelter. And that was, some of the legislators heard that and they loved it, but then all of a sudden as it trickled up through, whether it's Haima and DOH, it just got side pocketed. So don't know where it went.
Yeah, and that's the big question. I think people are asking, what's the, I guess, hesitation? What answers are you getting? What are they saying to you in terms of why they don't want to pull the trigger quickly on these types of ideas? Are they too outside the box, or they're not prepared enough?
No, let me say these are not outside the box, and I'm not going to take credit for being a genie that's just created these. These are
for Hawaii, I guess.
Yeah, I guess it's maybe. Well, I mean, basically, these are happening all over the United States right now. A lot of another thing I do want to bring up is that the other big cities right now are using the excess hotel rooms. That's your other option. You just basically take the empty hotels, you take the shelters and you put people in hotel rooms. Then you take shelter operators and you let them just put their people on the floors to just oversee them. But between shelter operators, convention centers, and stadiums, this is going on across the country. So this is not recreating the wheel. It's like it's happening all over the United States right now.
Mm-hmm. Okay. Well, at least, we're aware of the possibilities that are out there. It's just a matter of trying to get it done here, it sounds like. So.
Well, the whole concept with where we are with COVID is it's being preventative. So right now, we don't want to wait for an outbreak. We don't want to wait for a cluster. We need to prevent a cluster. So we need some leadership to step up and say, this is a extraordinarily at-risk population. Let's do something about it. And let's just not talk about it anymore. Let's do something about it. Think about it. We have so many options in our state, whether we use the hotel rooms. And I just think that the Hawaii tourism and, I'm talking to Mufi quite often, they are just opening the doors to be supporting the people of Hawaii. So it's not at that level. I think they understand that how do we open the state back up? we open it up by stopping these big outbreaks, by continuing to identify everybody that's positive, and making this, curve flatten as we talk about. That's how you do it. And can you imagine if we get 200, 300, 400 people in the homeless community that all become positive? That's going to set us back a half a year in our development of what we're trying to do.
Yeah, good point. And Dr. Scott, thank you so much. I know you have to go because you're leading that effort over there, but we appreciate your time as always to give us insight on this.
Yes,
as always. And thank you to you and your volunteers for all the great work that you're doing to keep us safe.
Yeah, thank you so much. Here, let me just give you a little over the shoulder. Here's a little tent
sure.
Right
give us a shot.
Yeah, there's some of my volunteers right there. Say hi to, well, they're waiting for more cars. We got some, we got some first responder lifeguards coming up, which we're really being careful to make sure our first responders are safe. And here is the rest of the a little slow right now, but we have a nice space here at Cocoa Head District Park to do screening. And
lots of big room, yeah.
Yeah, lots of room, and that's what we like, so that it can spread out. And you never know, like we've done some of these where there are cars streaming everywhere, but this has been more of the trend. And so right now, thanks to all the volunteers, thanks to the people of Hawaii for following the guidelines, and I'm looking forward to talking to you again, Annalisa, anytime. You're a star. Thank you.
We always love having you because you keep it real, Dr. Scott. Our show should be called Keeping It Real. All right. Take care. Thank you so much.
Yeah.
Aloha.
Right, aloha.